Under Trump's new plan, medical costs would go up for less cover, which is in contrast to what the president himself has previously said.
People were suffering so badly with the ravages of Obamacare. And I will say this, that as far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident.
According to the US Congressional Budget Office, the legislation aimed at repealing Obamacare would see premiums rise at first, with overall care reduced.
The report makes clear Trumpcare would be a cancer on the American healthcare system. Your premiums are heading up for the next several years if Trumpcare passes. 20% increases in 2018, 5% following year.
So how does spending on healthcare in the US compare to other healthcare services around the world? In France, which is rated as the best care in the world, the cost of pharmaceuticals dispensed per person each year is just $634, compared to $983 in the US, and only $170 here in Turkey. The percentage of that cost that goes towards funding healthcare administration in the US is 14%, but just 5% in France, and the same in Turkey. And the average doctor's salary is around $186,000 a year in the US, but only $95,000 a year in France, and just over $14,000 a year in Turkey. But it's not just the cost of the rising premiums to cover the cost of healthcare that's causing concern. It's the standard of the healthcare that will be available if Donald Trump's plans go through.
Now, Republicans are crowing about premiums going down in the outer years. That's because the coverage is so bad. Of course the premiums go down, but you get almost no coverage. Cheaper insurance isn't going to help anyone if it doesn't actually cover you when you're ill.
On a more positive note, the federal deficit, the amount by which the US government's expenditures exceed its tax revenues, would fall by $119 billion between 2017 and 2026 under the bill. But many are asking at what cost to the nation's healthcare. Kerry Alexandra, TRT World.
Well, let's go to our editor-at-large, Craig Copetas, now joining us from Paris. Craig, let's start, for the benefit of our international audience who don't know what the Congressional Budgetary Office is. Just tell us, what is the CBO? Is it credible?
Oh, very credible. The CBO was born in 1974 when Richard Nixon got into a fight with Congress over who controls and monitors the White House purse. In the U.S., the United States Congress hands out the money. So this CBO was put together. A chairman is appointed by the Speaker of the House in conjunction with the President pro tempore of the Senate, who is the second most highest ranking man in the Senate. And what they're like is a big actuary company. And what they do is essentially crush the numbers. The problem is, Matthew, is that politicians don't like the CBO when its decisions are not politically convenient for them, which is what we're seeing here. And outside economists in the private sector don't like the CEO whenever, the CBO, whenever they start screaming, well, we find their forecast to be inaccurate. And over the years, historically, it's been a very accurate barometer.
Let me ask you about some of the graphics we saw in that report there. Administration costs around about 3 times those in the United States of those in France and Turkey. What is going wrong in the United States?
Well, listen, the United States is having the wrong discussion. Even the most strident person who's into deregulation has to realize that the global health care systems are based on regulation. Healthcare around the world is basically handled like a public utility. You have a right to healthcare. It's not a commodity. And U.S. law and the power of the pharmaceutical companies and the American Medical Association makes that impossible. For example, here in France, which the World Health Organization has the best healthcare system in the world, the premier vehicle for healthcare, the French government can move in anytime they want to reduce the price of any good or pharmaceutical or service. Now, that's prohibited in the United States. You can't do that. There are standard fees across France. You can't have that in the United States. And when you look at the quality of care, as our reporter was talking about, the quality of care in France is quite good, and so is the quality of care in Turkey, because they approach health care as a public utility, that you have a right to have this, and we're not going to try and gouge a lot of money out of you for it. Are the systems perfect? No, but the governments have to take control, and the U.S. refuses to do this, whether it's the Democrats or the Republicans.
Craig, when President Trump was just a candidate, he never indicated that a lot of millions of people would potentially lose their health care coverage. He was merely saying, look, Obamacare is a disaster. We will repeal and replace it, and you know, you will love it because your premiums are going up and your coverage is coming down. Nobody mentioned 23 million people potentially losing their health care coverage. Why is this happening?
Well, because the CBO finally went in and looked at the numbers, focused on the numbers with a clear eye. But I say take it a step further, Matthew. Any one of us who has the good fortune to be under a healthcare system such as in Turkey or in France can only look at what's going on in the United States and saying that Obamacare and Trumpcare, as Senator Schumer said, both of them are cancerous. Both of them are doomed because they're approaching the problem from the wrong direction. You have to have single-payer care like Medicare. You have to have the government step in. You have to lower the cost. But America is so capitalistic in the healthcare system, and whatever, making that happen at this point in time is near on impossible. So this fight is going to go on, and whether it's 23 million or 20 million people who lose their health care, there's going to be a price to pay for America's intractability on making health care available to all of its citizens.
I think that is the key distinction there. Craig Copetas in Paris, thank you very much.